think of your relationship with your doctor as a lifelong relationship. Your health is your most important asset. You need to find someone that's going to be on your team that will really be your partner.
Hey everybody, it's Marielle Segarra, the host of Life Kit at NPR. Today we're talking about the doctor-patient relationship. There's something about those letters, MD. They're intimidating. It can feel like doctors are always right and that they have all the answers.
I always say I didn't have ESP to figure out what was going on, right?
That's Dr. Jennifer Merez. She's a professor of cardiology at Hofstra Northwell Health and co-author of the book Heart Smarter for Women. And she says this is why it's important to go to your doctor with the right questions and information. On this episode of Life Kit, we're going to help you talk to your doctor or physician assistant or nurse practitioner or any other medical provider. We'll go over how to choose one, how to prepare for an appointment, what questions to ask in the exam room, and how to push back when a provider isn't taking your concerns seriously. What would you say is the biggest misconception about the doctor-patient relationship?
You know, I think most patients feel that the doctor is all-knowing and that in the medical encounter or the relationship that they are powerless. And we want patients, people, and especially women to know that you have agency, that you have the power to ask questions. This is a partnership, and like in every partnership, you have to discuss what matters to you and share your story to really come up with a health and wellness plan or come up with a diagnosis.
When you go to the doctor, it can feel like they're all-knowing gods and they sort of sit up here and you're down here and you're not supposed to ask them questions. You might annoy them if you ask them questions.
You know, that methodology or that thinking comes from years of us being trained in medicine with the paternalistic approach, right? You know, our job is you make the decision, we figure out what's going on, and we're now transitioning to training doctors of the future or current day doctors to understand that healthcare is a team sport. So it's really moving to a co-creation of treatment strategies and personalized care based on your unique history and your individual needs.
Okay, so if you're looking for a doctor who you can have this kind of partnership with, is there anything you can do in the choosing part to try to figure that out before you even get into the room with them?
You have to do a little bit of homework. You know, speak to family and friends to find out who they're seeing, what has the experience been. There are patient groups that you can go online and figure out what they're saying. So I feel you need to look for a few things. You want to find someone who listens, someone who is going to take your symptoms seriously and foster that bond. You know, it's like dating. You go out on a date, you really have to feel the vibe and feel that you're connected. It's the same thing.
Okay, so let's say you have knee pain and you're thinking, should I see an orthopedist for this? Should I see my primary care doctor first? Should I maybe try to go to a physical therapist or something like that? Should you consider what expertise each of these people might have to offer and also what approach their field tends to take?
I'm a big believer that consulting with your primary care physician is really the first step, and he or she can help you figure out what else is needed. Or many women don't have a primary care physician. You know, if your OBGYN is your one person that you see, consulting with your OBGYN or your gynecologist can also, if that's your doctor who you use as primary care, speaking to that person definitely useful.
Okay, so let's say you have an appointment and it's your first appointment with this person. What should you be doing in the night before or 2 nights before to prepare?
You know, I would joke and say prepare as if you're going to your accountant, getting ready for taxes. You don't show up without receipts or whatever, right? So I think keep a logbook, right? Just like you keep your bank account. You should know, here's the family history. This is what has happened to me. Vital signs of, you know, things like your blood pressure. And just keeping those numbers and that record can help empower you for the next doctor's visit.
Is it helpful before your doctor's visit to go in and say, okay, when did this really start? How can I figure that out? Maybe I look at my calendar and I say, I remember I had it at that party and that was on this date. You know, is that helpful stuff to bring?
When you go in to describe any symptom, all of the information is important. So, when did it start? What was I doing when it started? How long has it persisted? What makes it worse? You and your doctor are detectives. The more information, the better, and the higher the chances of coming up with a diagnosis.
I think that gets at this whole point about us thinking that our doctors are just going to know the answer and that there is a clear answer instantly. Or sometimes you come in with something and, yeah, your doctor might not ever have a clear answer for you.
I always say I didn't have ESP to figure out what was going on, right? So it has to be a conversation and you have to share that information. And then based on the information, then we in the healthcare professions will go through our algorithms. It could be this, we come up with a differential diagnosis as we call it, right? And then we put the pieces together and decide based on the history and what you're telling us, whether you need additional testing.
And what does differential diagnosis mean?
So differential diagnosis is a medical term we all use in medical school to come up with a list of possibilities. So example, you're having sort of chest discomfort. We think it could be, heart disease, but also other things that can have a similar presentation like gastrointestinal reflux. So it's a list of possibilities that we match the symptoms to say it could be, diagnosis A, B, or C.
Okay, so sometimes you're at the doctor and you get a diagnosis. What are some questions you can ask in that moment about this disease? For instance, what if it is something potentially life-threatening? What are some questions you might want to ask about that?
You could say to your doctor, okay, what does that mean? Tell me a little bit more. What do we know about this diagnosis? What's the treatment plan? Do I need surgery? Are there medications? What are the side effects of the medications? Could I continue to eat the same diet if I have to take maybe a blood thinner or something like that? All of these questions. Very often though, and I would say reserve the right to say, okay, I'm going to come back with my partner, my friend, having someone with you to sort of discuss a treatment plan, especially if it's something that is a complicated diagnosis that could be potentially life-threatening is important, because I know for myself, brain freeze occurs and we have to be cognizant of that. And the healthcare team, and should practice the health literacy components or the narrative of health literacy to really say, to ask the patient, could you tell me how you would explain your diagnosis or what we discussed to a loved one? And it gives the healthcare team insight as to your understanding of, the conversation that just occurs.
If you know ahead of the appointment, especially on a follow-up, that there's a particular topic you want to talk about, some research you want to ask about, something that might require the doctor to do some reading ahead of time or some preparation, what's a good way to flag that?
We have with patient portals now, a lot of the questions you can fill out before you go to the doctor's visit. So you could easily communicate with your doctor or your medical team via the patient portal. And in today's world of telemedicine, you could always do a quick telemedicine visit. And I encourage patients to do that because it's a much faster way than getting a face-to-face appointment.
If it's a big diagnosis, I imagine you'll want to talk to another doctor about it. Can you ask your doctor for recommendations for a consult?
Yes, definitely. When you share sort of potentially catastrophic news, I think it's in everyone's best interest to get a second opinion.
Like, that's not rude.
No, it's absolutely not rude. And it's your right and it's your health. And it's, and sometimes with complex diagnoses, there are many alternative treatments and it's, within your right to get a second opinion.
If you go to a new doctor and you do what we've talked about, you've prepared, you have your questions, you bring your notes, and they kind of look askance at you, or they are like, what do you think, you're a doctor now because you look at WebMD or whatever? Is that just a sign that this is not the doctor for you?
Oh my gosh, yes.
Yeah.
Because you think of your relationship with your doctor as a lifelong relationship, right? On the journey to health and wellness. Right? Sharing information, customizing or personalizing a plan, a health plan that will work for you.
What should you do if you go to see a doctor and you tell them about a symptom you're having, but they just dismiss it?
That is a warning sign. And I think if that happens, you need to hit the pause button and take control again and say, let's talk about my symptoms. Did you not hear me? This is really what is bothering me. This is limiting my life. I get up in the morning, this pain or whatever is bothering me, I cannot go to work. It's nagging. I am dysfunctional without it. I need your help. So calling it out is important. And if you're still not being heard, and we know that medical gaslighting is a huge, huge phenomenon, and especially happens to women, women of color, people from the LGBTQ community complain about this, finding another doctor is definitely important.
And there are just so many doctors out there. Like, you don't have to stick with the allergist that you're really uncomfortable with,
Right.
know?
Well, it's interesting because I think that navigating the healthcare space is challenging. If you are a person of means and you can, you have insurance, it's easy to navigate. If you are socioeconomically deprived or not high socioeconomic status, or you are a person of color, it becomes really challenging. And access to healthcare is not equal, right? There's so many health inequities.
Yeah. So the thinking is basically, no, you don't have to stay with a doctor who's not a good fit for you. But also that's harder to say if you live in an area where there aren't as many doctors or medical professionals, or if you don't have insurance, so there are very limited places you can go to.
Yeah, definitely, if you don't have access.
Yeah. All right, it's time for some role play. I'm going to play the doctor, and Dr. Merez is going to play the patient. In the first scenario, she came to see me because she's dealing with symptoms that are sometimes dismissed or misunderstood by doctors: low energy and fatigue. We're 10 minutes into our 15-minute appointment, and I'm not really listening to her when she tells me what's wrong. Okay, so we should probably test you for vitamin D levels. Are you exercising regularly?
I used to exercise up until like 10 months ago. I'm just really not feeling up to par. I just have low energy. When I walk towards the subway, I find that my energy level is not the same. I get a little bit of a little shortness of breath, and feeling kind of blah has been sort of nagging at me.
Yeah, but sometimes you just have to get up and do it anyway, Like just try to motivate yourself. It's really important that we get these numbers in a better place.
But I feel like that this is a new thing for me in the past 8 months. Because if you remember when I saw you last year, I was trim, I was exercising. This is something that I feel is really nagging at me because it has. If you think about it, I haven't been able to exercise. I'm not sleeping as well. And this fatigue and low energy is something new. So it's affecting my daily life.
I mean, I could probably write you a prescription for an anti-anxiety medication, or if that's what you're feeling.
No, I think that it's not depression. I feel that there's something going on, and I'm having a hard time putting it together. I need your help in figuring out how to solve for this, what's going on with what's going on with me.
Okay. Well, we don't have a lot of time left, but yeah, maybe let's make another appointment.
But I feel like, and I've been doing a little bit of research, and definitely when I think about it, my family history of heart disease, my mother had heart disease probably about the same time, at the same age that I am now. So I worry about that. And I was reading that, I looked at the American Heart Association website, that women have strange symptoms. So if I were to help you, I think I need you to help me figure out what's going on. So another appointment, definitely, but this has been going on for 8 months. So do I need to see a cardiologist? Do I need to see someone else? What are your thoughts? I need help.
Yeah, I think let me get you a referral to a cardiologist, and we can talk about what you would bring to that appointment. So can you talk about what you did there?
I definitely called her attention to the fact that this was affecting my life. I went back to the fact that 8 months ago I was different, so that this is a new development. I talked about my concern of my own research, thinking of my family history, so bringing that into the picture. Noted the start of my symptoms and have been tracking the symptoms, all helpful to calling the doctor's attention that this is bothering me and needs some sort of diagnosis.
I think in that case, what you were talking about, they were symptoms of a potential cardiovascular issue. And you're an informed patient, right? And this is very common, especially for women and especially for women of color, to be ignored at the doctor's office. And you'll be saying that you have low energy, and it's just, well, you know, you should just fix that.
You should
You
just
know,
pull yourself up, toughen up,
But also at that point, Dr. Mirza, you sort of like, I'm done with this.
Yeah.
Like, I'm not seeing this doctor anymore.
Yeah. But I mean, you were good in saying, let's schedule a follow-up appointment. So it could be that you're going to hit the pause button and process, what you're saying.
What just happened.
But yeah.
And it's not that I'm saying that doctors, who do this are monsters. It's just, they might be, maybe they have something going on at home.
Right.
They're overworked. They just are not seeing you.
Right.
And they're not hearing you. And they're thinking, well, I don't even have time to eat lunch today.
I have so many
this
patients.
Other appointment, this other patient is sitting in the other room. Like,
but they could say, you know what, come back in whatever. They could say, write the symptoms down. Let's get a handle on this. Let's figure out how long has it been going on. Come back. Let's have a televisit in the next 2 weeks. Let me know what's going on. You know what I mean?
Yeah, I think what's hard for that is when a doctor does say, well, let's have a follow-up appointment, that's another copay. Or if you don't have insurance, that's another, it's a huge cost. It could be like $150 or $200 or something without insurance. So that's not so easy when you took time off of work.
Oh yeah, to
come here and now the appointment's over.
Yeah, definitely.
So I like that you pushed. You were like, wait, but I need, before you go.
Yes, tell me, yes. Yeah, definitely. And especially bringing the piece about my mother having heart disease at the same time was giving you a clue that, oh my gosh, there's a familial history. Should I hit the pause button and ask more targeted questions?
Yeah. Because if you don't, as a patient, advocate for yourself, you could miss something huge.
No one's advocating for you, right?
Yeah. All right, scenario 2. In this role play, I'm giving Dr. Merez a diagnosis for a condition called chronic urticaria. We're going to say she's never heard of it before, and she has lots of questions for me.
So my diagnosis of chronic urticaria, what does that mean?
So chronic urticaria just basically means chronic hives, and it can be caused by a lot of different things. In your case, it's brought on by cold temperatures. And it's kind of like, usually when there's an allergen, like let's say dust, your body responds to that and thinks it's an invader of some kind. And that's why you get this response, this allergic response. And in your case, the same thing is happening. Your body is creating that same response, but just in response to the cold. So that's what we've learned.
I've never heard of this. So how do we treat it?
There's nothing in your blood work that shows an underlying autoimmune condition linked to this. So it's really just going to be managing the symptoms with allergy medication like Allegra or Zyrtec, that kind of thing.
So is that going to affect any of the other medications? Like I take vitamins, I take multivitamins. Do I need to change anything?
No, the list that I have, you don't need to change anything.
Do I see you every 6 months? What do I do? Do I keep a logbook to write everything down? How do we monitor? Am I getting better?
I think we have to take this one step at a time. Okay. So let's see how you respond to the medication. We could start to come off of the Allegra. Like if you really aren't feeling symptoms, we could start to come off of the Allegra and do it like every other day at a certain point. And I think we'll follow up in 6 months, sounds like the right amount.
So one final question, what about cold food? Could I have ice cream? Could I, if you like sometimes have ices or something, you have that brain freeze, is that going to affect? Is that-
Unfortunately, it can. What we worry about is causing your throat to swell, especially if there's any lingering cold there. So we would say avoid ice cream, avoid frozen foods. Don't do the polar bear plunge in January.
Okay.
Definitely don't do that. And generally don't go from like really hot to really cold temperatures.
Wow. Okay. No, thank you. Wow. So I'll see you in 6 months.
Yeah, and
if anything happens, definitely call.
Yeah, or send me a message on the portal. And if you want to come back and talk about it more, if you have any other questions for me, we can do that. You're also welcome to bring in a friend or your partner or whoever if you have more questions.
Thank you.
All right, how'd I do?
Really well. Oh my gosh.
It was interesting in that moment. I do know a lot about chronic urticaria because it's something that I had.
Yes.
But you asking me all those questions, I suddenly was like, whoa. Was
that my question?
No, but they were good questions. But you were confused and you were like, what does this mean for my life? But I was like, slow down, lady. I'm trying.
But you answered beautifully. Yeah.
If you had to pick a word that people should embody as they plan to talk to their doctor, what would it be?
So I think 2 words. One, and most importantly, partnership. And then the other one is empowered. Think of it as you're coming in, you're empowered, you have an active part in that partnership.
All right, let's recap. Think of your relationship with your medical provider as a partnership. You should be working together to come up with a diagnosis or a plan. Keep a medical logbook with details that might be important for your health conditions. If a doctor or other medical provider isn't hearing you, be as direct as possible. When you get a diagnosis, consider a second opinion. And also bring a friend to help you ask questions and take notes. Lastly, it's okay to change medical providers. And it actually might be a good idea if they're not listening to you, or if they confuse you, or if you don't feel like you can talk to them. Sometimes it's just a chemistry thing.